From cancer to diabetes, broken bones to flu, a huge amount of money is spent preventing and treating our physical illnesses. Today, a high-profile campaign began for the same level of sustained government investment to tackle mental ill health. Gordon has a physical condition, HIV, and a mental one, post-traumatic stress disorder. His HIV treatment was swift. Getting therapy was not.
I waited 102 weeks. Just under 2 years for treatment in the NHS, and it was a really difficult time. If I had been asked to wait for 2 years for treatment for HIV, I would be dead.
Mental ill health accounts for 22% of NHS workload, but only gets 11% of its expenditure. It results in 70 million sick days a year. That's the leading cause of employee absence. And the overall cost to the UK is estimated to be £100 billion a year.
If you go into our police cells, if you go into our prisons, if you go into every level of the healthcare system, you often see people who, had they got help at an earlier stage, they would not be there now.
5 News recently followed this team in the West Midlands, where psychiatric nurses work alongside police officers to get people in crisis the right kind of help. During the coalition government, the Liberal Democrats championed projects like this, but the former mental health minister now fears progress will stall.
I feel I left with the job half done. We've got so much more to do. We need the Treasury to recognise that if they say they believe in equality for mental health, they've got to put their money where their mouth is.
The government says it has invested more in tackling mental illness than ever before, and great strides have been made. But there is no word on whether the Treasury's future plans include extra money for mental health services. Catherine Jones, 5 News.